Let's invite our last speaker, Mr. Chunming Wang. He will share with us his valuable experience and expertise regarding smart hospital development. His discussion within the context of aging population is drawn from his role as the director of the Smart Hospital Development Department at Renji Hospital of the Shanghai Jiaotong University School of Medicine. May I call on Ms. Chunming Wang, please.
Thank you very much, ladies and gentlemen, and so honored to be invited at this conference to share a little bit of the work that we have done and what we are doing at the moment. So, firstly, is a little bit background about the population aging from our hospitals, side. The first is China increasing, the population aging that lots of the speakers has addressed, in this whole day session. I will skip that. But from the hospital side, that's, not just only the population aging, but also there are lots of, amounts actually with the chronic diseases. And in addition, they are not just one chronic diseases, but several chronic diseases. And at the meantime, they are together with some of the cancer-related or cardio-related, issues. And also lots of disabled and also partially disabled as well. And also in China, because of the, very strong promotion from the government side of the health promotion, so more and more people that realize, they want to have their healthy life, aging healthy life. So they increasing access the healthcare services. And also because of we have lots of traditional Chinese medicine like herb tea at the moment, in summer or pre-summer area. So lots of the population, especially the elderly population, that willing to access more of our healthcare services. So afterwards, that's the elderly face digital device access, in medical services, because firstly, lots of the elderly people that their insufficient understanding, of the internet. Although the total, population is raised to about 57%, but still there are over 40% of the population, elderly population, that's not that familiar with the internet or related. And also there's a low utilization of the, medical, smart devices like smartphone devices as well. And also, the elderly-oriented internet services need to be improved. We have created over 3,000 internet hospitals in China, but there are fewer internet hospital and platforms for diagnosis and treatment, set up the areas, especially for, adapt with the elderly population. So to deal with that, to improve the elderly-oriented, medical devices, seems to have to be great significance, not just individually, but institutionally needs and also the social needs to help the elderly to bridge the gap to improve the access of our healthcare services. So there's basically two solutions from our hospital side. Firstly is to address the elderly-oriented medical services adaptation for the elderly population. Secondly is that to create some of the innovation medical services module to deal with the aging population. That's the two major solutions. So firstly is the explore of the elderly-oriented services that's based on the services of our hospital. So a little bit introduction of the hospital. The hospital itself is also old. So it's been, founded in 1844 by a London missionary. So this year is 180 years anniversary of this hospital. Now it's affiliated to Shanghai Jiaotong University School of Medicine. And, it's the cradle of the Western medicine education in China as well. And lots of the first open heart surgeries with acupuncture anesthesia have been delivered in this hospital. So totally, this hospital has 13 campuses around in Shanghai, 5 major campuses. So last year, it served over 6.45 million outpatient emergency attendants, and with over 230,000 surgeries of these hospitals. So indeed, in the hospital itself, to increase the efficiency, to fulfill that amount of the demand from the, our population, especially from the, Asian population. So we also created our international medical service as well. That's been, accredited, by a third-party accreditation company. And as a tertiary hospital, so it's created, collaborates with University of Ottawa as well to create some of the, English curriculum, teaching curriculum, and also lots of the clinical research as well. So, so the hospital overall is going to be built as a national medical center, and also, fulfill the mission as Shanghai to be built as one of the leading medical centers of Asia. So based on that hospital background, so it has 4 major aspects that's focusing on the Asian population adaptation. First is to focus on the convenience of medical services, to improve the whole process with the medical treatment from the elderly population. Secondly is to deliver the service continuity. That's not just after the offline session that let patients go, but with the online platforms to let the service continuously. That certainly is a comprehensive service, because we have lots of disciplines. This hospital has 54 different disciplines. Each discipline has subsidized as a sub-discipline over 5 sub-disciplines. So therefore, there are over 200 sub-disciplines for the population. So as for the aging population, it is really hard to find the right person, the right expertise to to deal with their problems. So the third is for the comprehensive services altogether that's delivered to the aging population. The fourth is to create the medical ecological the integration for the population. So as the smart hospital based, so we're based on these 4 aspects that's subsidized to 3 major aspects. First is the smart service, mainly focused on patient-oriented accessibility and experience. Second is smart healthcare that's focusing on the medical staffs oriented, like to enhance their efficiency and quality and safety of the healthcare delivered. And third, from the smart management side, that's focusing on managers oriented, like to enhance the suppliers, medical suppliers, and also the continuous development of the hospital. So there's some milestones that based on this framework, that's in 2018, that's all these systems have been integrated with our multi-campus system, that all these offline resources being connected, that's the first thing. The second thing jointly is that in year 2020, that we launched our Internet Hospital platform. And also the same year, the medical payments with the social insurance payments that been also online as well to support the Internet Hospital as well. And in year 2021, the centralized reservation platform that went online, meaning all these medical devices and tests that can be reserved, make the reservation purely online and be calculated by the system with the best solution. And also in year 2022, the AI patient assistant been launched as well. So as the mentioned in year 2020, that's very big for a hospital that launched our internet hospital platform. You can see that after 1 year, the monthly access of the purely online consultation that exceeded to 1,000 patients after 1 year. But another year after that, in year 2022, you can see that the patients purely online that's exceeded to 15,000, which is 15 times comparing to the year before. And after only 8 months later, in year 2023, and it exceeded again to 30,000, which doubled again. So lots of people actually began here that's using internet platform that's to deal with their situations of healthcare. So far, that we have 53 different disciplines that's purely online, and over 1,100 experts that medical staffs that register online can see patients anytime at this moment, and also registered 6 million patients that's on this platform, service totally over 11 million patients online, and purely consultation, prescription, and charged by social insurance, and their medications be delivered directly to their home, over 1.2 million already. So we integrated lots of the online service and offline service all together, and integrated with the outpatient service and check-in patients as well, and also together with the follow-up patients. So all of these, online and offline integrations been supported once again, because the data has been, continuously. So we can use the AI assistant to support patients, to let them know what's the next step, and also the system can guess what the next step might be. So, and also for lots of the elderly, people, patients that cannot use smartphone or these, smart facilities, we also connected with their young generation, meaning their children can actually use their parents, social insurance, account to, make the, ask doctors online, and also makes the prescriptions. And that medications can be delivered, freely to, their elderly generation's home directly. And so we enhanced lots of, actually, 100%, nearly 100% of our medical services, like, DR, CT, MRI, PET CT, that's online with our centralized, reservation system. So the patients, can see doctors online. Doctors can make prescription of these, tests online. The system will give them the best solutions, and patient not necessary to come physically to see doctors to get that, test. So meaning they can at least save one-time visits physically. And also we opened 2 months as the best solution period of time, 2 weeks time, let patients to pick whatever time that they are free, because the best solutions that delivered by system actually are probably not the best, time or date for our patient. So we let them to choose once, and also together with lots of the pharmaceutical companies support that the medications can be delivered to patients' home freely. Last year we have delivered 184 different cities of these countries, for our patients. And again, we connected with our commercial insurance as well as the support of the social insurance. So we firstly connected 100% with PICC commercial insurance, meaning their customers, accounting systems totally connected with our hospital's accounting system. Patient not necessary to register, twice. They just freely, use their PICC, on their cell phone and connected to see our doctors directly. And with this mark from the PICC, if they are in a package of commercial insurance, after they finish their consultations, they are partially being supported by social insurance financing, but if the small partial that covered by commercial insurance, they can do the reimbursement directly using this system, not necessary to handing lots of paperwork or take photos like old times. Again, with this system, because it's more efficient, so we open lots of the specialized outpatient services, like specialized nursing services, especially to deal with the aged population. So if we open the offline nursing specialist services, actually it take lots of the resources, and also they can access few patients population. But we opened online, actually, lots of patients began to access and use that very well. So we developed largest, not one of the largest, but largest, experience center at our outpatient first floor at our outpatient building. That's each year we can serve over 150,000 patients to help, especially help the elderly, patients to start their journey to use the, smartphone. So you can see that photos, lots of the, patients, their first time experience, they refuse, but our staffs to let them to start. And after several times, they begin as a big fan of our, smart hospital platform. Our oldest patients who use this platform by themselves, not by their younger generation. The oldest patient actually is 98 year old by our accounting. Moreover, we use AI support as well as the digitalized customer services, because offline service, again, that's limited by time, limited by the space. It's online customer services that's actually can serve 10 times, of the total amount. So we collaborated with Tencent, to open this 7 days, 24 hours, automatic customer services. And we also built our knowledge graph. And just we finished, established this, graph, and the big language models started its journey. So we collaborated once again to upgrade, the big language, engines to support, and then created a digitalized customer services, meaning patients not necessary to type in their cell phone. They just, speak with these digitalized customers, and customers services can give the feedback very quickly, smoothly, and guide patients to the doctors, to the specialists that adapt with their situation. So also we open lots of the free clinics online. So if in old times actually lots of the physical offline free clinics, but patients have to travel around, use metros, taxis, come to our hospital site to access this free clinic. But once we open that online, you can see that each year we can open over 100 free clinics online. And with this waive up of the consultation fee, but still for the medications and the tested, they can be supported again with the social insurance and the commercial insurance as well. And last part is that the innovation mode of the to deal with the aging population that we created together with the local government and the Shanghai municipal government, as well with the internet hospital plus nursing home. Why we do that? Because the elderly caring model in Shanghai is called the 9073 model, meaning 3% of the elderly care is in the institutions, 7% is in the community, and 90% is based at home. So we started firstly at the institutions, which majority are the nursing homes. And then this year, we from the nursing home to the communities to let the elderly to more and more realize the platforms and access the platforms, and eventually go to home-based elderly care. So the service objective of the internet hospital plus nursing home is that three model. The objective is the elderly people in nursing homes are able to access tertiary care directly, not necessary to come out of the nursing home, but inside nursing home, they can use this tertiary care directly. And also online diagnosis treatments for the elderly, and also family members accompany online with their elderlies, and also convenient referral system, both online and offline. So so far, we connected with 8 different districts, 45 nursing homes, and covering over 16,000 nursing home, medical beds. So we established lots of mobile experience center to let the elderly in the nursing homes to start their first journey, as so as their younger generation. And also started the nursing home clouding consulting room, supported by our 10 different disciplines that's related to the elderly populations. And then because of the clouding consultation room, that is online, it's not limited by the physical and the time limitation. So it can be run 7 days and 24 hours. So patients and their younger generations can access anytime they want to make the registration to find the right experts. And that is the 10 different disciplines that's related to this nursing home plus internet hospital platform. And also, to let the elderlies, inside the nursing home, not necessary to come outside to our hospital, we put all of our, lab test system into the nursing homes. That photo is actually, not, in our hospital side. It's in nursing homes. Actually, patients, not necessary to take blood samples, at our windows. Hospital windows, but in nursing homes. And they gather around all together with all of their, elderlies in the nursing homes and come to our hospital, because it's in the same platform. So when we issue the reports, their cell phones and their younger generations, cell phones actually can read the reports automatically, just within seconds when we issue the reports. And once again, they can use the online hospitals to ask their specialists once again based on their reports. And that's not necessary to come out of the nursing home. And we also put 24 hours EKGs tests into the nursing home. In old times, if they want that kind of test, they at least have to come to our hospital for 3 times. First is see a specialist. Second is make an appointment of these EKG devices. Thirdly is that after 24 hours, they have to return that devices. But with this, whole 5G-based, whole system, the elderly is just inside the nursing home, not necessary to come outside. The data actually can move automatically based on 5G's system. And also it promotes all the medical staffs, all the related staffs, doctors of the nursing homes with their, services qualities. And also we created like the smart check-in connection and follow-up system. You can see that, doctors can issue the check-in online based on their cell phone. And that is the case that from one nursing home, that's 3 elderly people that access our smart, hospital at the same time. They need these kind of surgeries, under the same discipline. So they book a time. At the same time, the nursing home arrange a car that's come to our hospitals offline to check in at the same day, doing the surgery same day, and in the same medical wards, and be checked out in the same day. Without this smartphone platform, it's really hard for these elderly people to access our facility and services. And the best scenario is that they wait for emergency attendance. And then with the surgery, they can do the lifelong, follow-up, also use this smart platform. So we, together with the government, we issue our white books of the, internet hospital plus nursing home, collaboration, SOPs, because lots of the nursing homes, connected with us. So we have the SOPs of the collaboration. And also, supported by the National, Health Department of China. Then we, together with 12 provinces, 35 organizations altogether to do the research of the next generation of our internet hospital-based smart hospital platform. And also we gather around lots of the partners, close partners all together all over the world. That's all together to make continuously of this job to deal with the Asian population and for our elderly patients. So once again, thank you so much for this invitation and to share and to discuss. And hopefully more and more partners through this platform can join us all together to serve the aged population, not just in China, but in the ASEAN+3 region countries and more countries in the future. Thank you so much.
Thank you, Mr. Wang. Very comprehensive introduction about the Renji Smart Hospital. Very informative and very impressive. So I wonder if there is any questions for this presentation. If no, okay. So, please.
Thank you for the presentation. Very interesting because I work on the digital economy. For the MRI and CT scans, I wonder how this is done if you're doing this on your neck or a specific body. So essentially, you don't need to have a doctor next to you. You just do it yourself, and then the doctor sees it and then prints it on the screen for you. How does this work? Oh.
Thank you for this question. So it's based on the centralized reservation system. Because without this system, you have to access our hospital to see a doctors offline, and then the doctors issue the prescriptions of this MRI, for example. And then you cannot access the MRI test at the same day because it's so limited resources. And then you have to make the reservation that day you visit our hospital, and the next day, maybe 2 weeks later, to access the MRI. But with this centralized system, you can access our hospital's experts online, not necessary, to come to our hospital physically. You can see the doctors even with your pajamas at home. And also with these issues of this MRI, the system will give you automatic time with the best solution based on the system. Let's say 2 weeks later, and then that resources is based on our 5 major campuses resources. And at the same time, that opened 2 weeks allocation of the resources for the patient. Patient actually can pick up any of the free resources that's available, like they pick up film, theaters, seats, because the best solutions delivered by our system, not the best solutions, maybe not best solution for patient. So they can pick up, but only once to change their times. Hopefully that answers your question. Yeah, but they can come at that time, at that place, not necessary to come, twice or 3 times, right? Thank you.
Thanks. This is very exciting. I'm wondering how many similar internet hospitals exist in China today, are doing the same thing as you guys. And then I was wondering about what share of the hospital services are now being delivered through the internet hospital as opposed to the regular hospital? And how much of the use of these services do you think is new demand because it's become more convenient that these are people who would not have really looked for these or used these services before, but now they're doing it because it's much easier?
And so firstly, there are over 3,000 internet hospitals in China, but not every hospital in this scale, and not every internet hospital that's connected so well with multi campuses altogether. So in Shanghai specifically, there are 35 municipal level tertiary hospitals including the comprehensive and the specialist hospitals. So all 35 hospitals, tertiary hospitals, all open their internet, hospital platform as well. So last year, our hospital generates 25% of the total amount of service of these 35, internet hospital platform. That's the figure briefly. And then last year, actually, we served purely online, registered with social insurance prescriptions, and also delivered to their homes. That's counting services around 300,000 patients. Comparing to 6 million, it's just a start. It's just a start. This year, we're trying to double that size as well. Because if you connect it so well together with the primary care, and primary care institution can also refer their patients, not just physically, but online directly. Without this platform, actually, primary care, family medicine doctors, with the referral letters or referral opinions, then the patients has to come to our tertiary hospital at some time, not the same day, but with the internet hospital same day, simultaneously. They have the QR code, like a family medicine specialist, QR codes online with the second opinion or tertiary, opinion as well. Thank you.